Well, I think one thing I think is really great about public health is there's a lot of different things you can do with an MPH. So I did my master's in public health at Yale, and there were several tracks you could do, like health policy, if you're interested in policy work or management. There's more research tracks, like working sort of with, on studies, like medical studies or studies like at a university or institution. And so, I really liked that and I sort of wasn't sure when I went into the program, like what I could really see myself doing as a job afterward. I was sort of still thinking of the Peace Corps and sort of working in global health in that context, but then during the 2 years, there was so many other opportunities and so many other things I became interested in. And I did go into this job. I've only been there, I guess it's been 2 years now. But I sort of enjoy working with the numbers, which I didn't really expect that I would go into right after the MPH program. But it's a really, really important skill, and it's really transferable to sort of any type of job. It's really like it's the power of the field of public health to be able to sort of quantify and show, results and sort of what's happening in the population at the population level, and that's how sort of at any level, whether it's like a community health center or at sort of any level, if you want to get funding, you need to show that what you're doing is working and having an effect, a positive effect. So,
great. Yeah. So what track were you specifically in the MPH program?
I was in a track called Social and Behavioral Science, which was like the broadest track because I still wasn't sure what I wanted to do, but it was sort of looking at the social determinants of health and like health disparities. So sort of looking on a broad population level, what are sort of social and contextual factors like race and poverty and socioeconomic status that really impact public health.
Did you ever consider medical anthropology or graduate school post the MPH?
Yeah, I definitely, I took a class in medical anthropology and I loved it, and that's actually what sent me into the Peace Corps. So I was really interested in medical anthropology, and I do think that there's a lot of overlap, and studying sort of the cultural context of health is really relevant to that, and as well for public health.
Now, when you say that you do quantitative research, does that include using large amounts of data, entering them to an SPSS program, and then producing results from there?
Yeah, so we do use SPSS, which is like a statistical software package. In any MPH program that you go to, you'll work with either SPSS or SAS, or one of these statistical analysis programs. So we don't have to enter the data, but we get these large data sets, and we have to produce the results. So we show, and they're huge data sets because they're national, so 18,000 people in a program. We do sort of descriptive statistics, so looking at, race, ethnicity, gender, age, and then also the people that go into these programs take a survey before they go into the prevention program, and then afterwards when they come out. So we look at outcomes like past 30-day substance use and attitudes about risky sex, all these different outcomes related to substance use and high-risk sexual activity, and then we look at how people changed as a result of the prevention program.
Have you participated in community-based work situations? And if so, what are the pros and cons that you find with those?
Okay, so the question was about community-based participation.
No, go. You answer first.
Yeah, I mean, it's so that's a type of research which really like involves the community, and it's great because like the community has a big stake in what's going on. So it's instead of just like, some researchers deciding, oh, we're going to do a project in this community. It's like inviting all the sort of community members to the table and having them sort of help design the program and the data collection methods. I have read about some studies that have used that method. I don't do that in my current job, but it is a huge plus in that it involves the community, and the programs are like well tailored to the community because the people know the needs of their community. And then I guess some of the downsides are it's always sort of messy when you're doing research in involving a whole community.
We sort of do that, so we'll
Yeah.
talk about it
Oh,
more
good.
in depth.
Good.
That was a great summary.
Because CSAP doesn't use that model.
Just quickly, I maybe should have done this before. Who is in their first 3 years of undergrad? Just raise hands. So great. Juniors? Seniors? Oh, the blues. I'm going out to the world. Okay, and any grad students? Great. People with backgrounds in some kind of health science, social science, humanities, math, hard science. Yay! Engineering? Okay, so computer science? Okay, so that's who we are. Who thinks they might be interested more in an international kind of opportunity? A lot, yeah, that's what I thought. Okay, and domestic or home here in the U.S.? Just so I should have let you know before we started talking, but thank you. That's great. So there's time for questions at the end, and even while people are talking. Drew Taylor is going to speak next, and he is an alum of the Northeastern program.
So, hi, I'm Drew, and my organization, I would say 85% of the time works in community-based participatory research. So if you have questions specific to that, you're more than welcome to contact me. I should say, I think it actually might make sense if Rory introduces herself too, because we tend to work together on some things. So,
Hi, I'm Rory Weir. I also attended the MPH program here at Northeastern, and I get to work with Drew a lot, but I'm on the community end. I work at Upham's Corner Health Center in Dorchester. So when he's writing these big grants, he'll approach a variety of health centers, and sometimes Upham's is at the table.
So CHEERS, the Center for Community Health Education, Research, and Service, is a nonprofit extension of Northeastern University that is a community academic partnership, which means that we have a partnership of 15 health centers and community-based organizations, and we connect them to research at Northeastern. So we also connect them to research with Harvard Medical School, Harvard School of Public Health, BU School of Medicine. Currently, at this very minute, I'm knee-deep in a grant that involves 5 community health centers, 5 public housing developments, 10 schools, and Boston Medical Center, Northeastern University, and a number of public housing developments. So that kind of shows you the kind of broad dynamic of who are the stakeholders in public health. I think one of the things I like to introduce for people about public health is that you can work in public health in almost any field that you're in, whether you're a teacher or you're a doctor, or no matter what it is, you contribute to public health in some aspect. So I think it's important to remind people of that.